It is time for spring cleaning, and while we always think about the rooms in our house or maybe our closets, you might want to add your medicine cabinet to the list. Luke Van Osdal is here to tell us why this is so important. He's a clinical pharmacist at the Cone Health Community Health and Wellness Center Pharmacy. Good morning.
Good morning. It's great to be here.
Oh, you know, this is the time of year we think about getting and cleaning out. You know, everything is clean and new. You want to do that with your medicine cabinet too. Why is that? Absolutely.
So part of spring cleaning, especially from a pharmacist's perspective, involves just the basics of checking expiration dates. The Food and Drug Administration, they really set safety and efficacy standards. So what that means is they make people who manufacture medications, they make sure that their products are safe and effective. And part of that is including an expiration date where they can guarantee you if you use that medication before that date listed, they can 100% guarantee you that it is safe and effective.
And that it will work.
Exactly, exactly. So the safest practice is just to, I know there's a lot of riffraff and debate, but the safest practice is to pull those medications that are beyond their expiration date.
And when we're talking about this, I mean, we're not just talking about over-the-counter medications. If you look at your prescription bottles, there's also a use-by date on there as well, right?
That's absolutely correct. 9 times out of 10, it's right at the bottom of that prescription label. And you can see that, and it's generally, for most medications that go in those prescription bottles, it's generally about a year after that medication has been filled.
So let's talk about what you do then when you go through your medicine cabinet and you pull out the things that have expired. What do you do with them? You don't want to flush them. You don't want to just throw them away.
Absolutely, yeah. So there's actually quite a bit of methods and approaches to this. I will say that probably the safest thing to do is ask your pharmacist. There's so many different medication forms out there. There are tablets, capsules, inhalers, patches. So the best thing to do is ask your pharmacist how to dispose of those medications. Additionally, what can happen is you'll see a lot of take-back programs and a lot of drug receptacles where you can go and you can actually place those unused or expired medications. Me, myself, I work for Cone Health. I work for the Community Health and Wellness Center in Greensboro, and we actually have a big green rectangular receptacle, and it's area where our patients can dispose of those medications that they're not using.
So the question is, do we need to take the labels off of them prior to?
Yeah, so that's a very good question. And in areas such as that where you actually dispose of the medication at the pharmacy, a lot of the times you don't have to worry about that. If you were to dispose of your medications, let's say you have some empty prescription bottles that has your information on there, it is absolutely a good idea to go ahead and try to remove, I know it can be tricky because they're sticky, but you can remove those labels off of those bottles and then safely dispose of those bottles.
Yeah, and we're talking about things like, a lot of sheriff's departments will have the medication take back so that they can be disposed of properly.
That's right.
And that's a good way to do that. All right, thank you so much. Good information this morning.
Absolutely, yes,
He's a Duke fan, y'all, so I've already given him the Virginia Tech sign. You can find more healthy lifestyle and safety tools by going to conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.